These are dark and uncertain times. Some healthcare workers feel there's little hope on the horizon. As the sun rises over Leicester, the day ahead will be one of frustration and fear.
It's time to get ready for another day at work. As a nurse, I sometimes get worried, especially because I have contact with patients with COVID-19. In my case, with a young family, if I get infected, potentially I can infect my family as well. But let's see what today has in store.
Fumni Adenle is a ward matron at a mental health unit in Glenfield. Some of the patients have tested positive for COVID-19 and have to isolate 24 hours a day in a bedroom.
I've been dealing with patients who are really angry and very agitated and taking it out on staff members on the ward. They lash out at staff members. It can be a bit scary sometimes.
Fumni sympathises. He says the nature of the illness makes it hard for some patients to understand why they need to isolate.
Some of them wanting to bite staff members can be really hard, to be honest. I've had patients spit at me, and that's quite anxiety provoking, knowing that this patient has got COVID-19. I have moments and days where I feel quite, like I said, very anxious, and I do worry about not only myself, about my family. And I also do worry about the staff members, because I'm a manager as well, so I have to manage the anxiety of the staff members.
Everyone is obviously adjusting to a dynamic situation, so we can't help but have a sense of fear.
He also has concerns about the disproportionate number of healthcare workers from minority communities who are dying from COVID-19.
I really hope I don't get it, and if I get it, what if I die? How does it affect my children? My children are quite young. How does it affect my wife? My wife's a pharmacist. It's quite worrying.
All of this takes its toll on his mental health.
For me today, I've just been really tired. I'm more tired emotionally than physically, to be honest.
Fumni draws strength from his family, his faith, and is supported by his employers. Do you ever find there are times when you think, I don't want to go in today, I can't do this?
It's crossed my mind, but I wouldn't do it. And the reason is that I'm trained to be a nurse, and part of being a nurse is for times like this.
He believes in staying calm, and as we drift through the crisis, he says something positive will emerge.
What unites us is bigger than what divides us. After all, we're human in all of this, and COVID-19 does not discriminate. It affects everyone.
Just let's hope it doesn't come tumbling down.
It helps us to set our priorities right. It helps us to value the important things of life and to appreciate everyone, really.
So let's rearrange it. No, let's just keep this one. Just take some of these and continue.